If your low back has been achy, stiff, or flaring up with everyday movement, these are a few simple physical therapy exercises you can do at home to help reduce pain, improve mobility, and start moving with more confidence. One of the biggest mistakes people make is focusing only on the painful area. The low back becomes irritated because other areas aren't moving or functioning as well as they should. In particular, above the chain or the thoracic spine often gets stiff and doesn't extend or rotate. And then below the chain, the hips often becomes very stiff or weak and doesn't rotate or extend. That means this low back ends up working harder to take up the slack for the other parts that aren't working as well as they should. So today I'm going to show you 4 simple physical therapy exercises that can help improve mobility, build strength, and reduce unnecessary stress on the lower back. Let's get started. The first exercise is the shoulder sweep. This exercise targets this thoracic spine, which is often overlooked in people with low back pain. As we spend more and more time driving, sitting, looking at our screens, this upper mid back can become stiff. When this becomes stiff, the lower back compensates by moving more than it should.
Lie on your side with that top knee bent up and on the ground. Bring that upper arm and circle all the way around. Your goal is to pull your shoulder and your hip apart, trying to get extension and rotation of your thoracic spine. Go slow and controlled. Eke out a little bit more range of motion with every rep that you do. This should feel good.
The second exercise is half kneeling hip flexor stretch. Tight hip flexors are extremely common, especially for people who sit for long periods of time throughout the day. When the front of the hip becomes stiff, it can make it harder to extend the hip during walking and other activities. As a result of this, the low back is going to compensate.
Get into the half kneel position with one knee on the ground, the other foot planted. Shift forward onto that front foot that's planted. As you shift forward, squeeze your butt muscles of the leg that's down. Hold that for 5 seconds, relax back, and repeat. Switch legs and do the other side.
The third exercise focuses on hip external rotation and range of motion strengthening, so those hips going out. Flexibility is important, but strength within that new range of motion is what actually gets that new range of motion to stay.
Lying on your back, bring the soles of your feet together and your knees apart. You can put yoga blocks under your knees so you have something to push into. You're going to push your knees down towards the ground or the yoga blocks. Hold them for 5 seconds and then relax and keep repeating that. You are going to feel a stretch in your groin muscles and a strengthening in your butt muscles.
The final exercise targets hip internal rotation and range of motion strengthening. Hip internal rotation is one of the most commonly restricted motions I see in people with low back pain. Just like external rotation, we don't simply want to get more range of motion by stretching it. We want to strengthen within that new range of motion so that new range of motion stays.
Lie on your back with your knees bent up. With your knees staying together, you're going to bring one foot out to the side, hold that for 5 seconds, and then switch to the other foot going out to the side, holding that for 5 seconds.
Now, do you need to perform all 4 exercises every single day? Not necessarily. Think of these as movement options. Pick 1 or 2 that feel really helpful and feel good for your body and perform them consistently. Many people notice that improving hip mobility and thoracic mobility helps them move more comfortably and reduces some of the stress being placed on the low back. Remember, for all of these, the goal isn't simply stretching. The goal is to improve strength through a full range of motion. If you're ready for change, book your free virtual assessment using the link below. We'll walk through what's driving your pain, discuss the factors that may be contributing to it, and help you understand what to do next so you can start moving forward with confidence. You don't have to keep guessing or trying random exercises. Sometimes having a clear plan is the fastest way to get back to doing the things you enjoy. Click the link below to schedule your free assessment, and let's figure out the next best steps for you.